Namaste. Let's begin the video with an overview on the topic septal surgery. The indications of this surgery are persistent symptoms of DNS, that is deviated nasal septum. I have covered this topic in another video. The age of the patient has to be more than 17 years, unless it is very severe. If it is severe, we can do it in children less than 17 years of old. Why this 17 years? Because secondary ossification centers in the nose fuse by 17 years, and if they get damaged, it can cause facial deformity. We perform this surgery under local anesthesia. The types are SMR, that is submucous resection, and septoplasty. Now we will look at the differences between these two. The incision in septoplasty is known as the Freer's incision. It is also known as hemitransfixion incision. It is at the caudal border of the septum. This is the location. In SMR, the incision is this. It is known as Killian's incision. As you can see in the image, Killian's incision is above the Freer's incision. It is 1 centimeter above the lower border of the septum. Let's understand the procedure of septoplasty first. We will give a Freer's incision, then mucoperichondrial flaps will be raised on one side using Freer's elevator. Then only the deviated part will be removed. Let's compare it with SMR. In SMR, the incision was Killian's incision. After that, the mucoperichondrial flaps will be raised on both the sides here. After that, most of the cartilage will be removed. This is the quadrilateral cartilage. This is the strip which we have removed of quadrilateral cartilage, and this is the strip that is remaining. This strut strip is left behind. It is L-shaped. We have seen that majority of the septum is removed in SMR. Therefore, complications are going to be more in SMR. And in septoplasty, less common complications. So complication that can arise is, one example is saddling of the nose. According to you, which surgery will be preferred? Septoplasty will be preferred. Why? Because of less complications. Nowadays, septoplasty has replaced SMR. We are done with the differences. Thank you and look forward for more videos.